John Hook's Newsmaker Saturday starts now.
Thanks for joining us. We don't want to beat a dead horse here, but we are going to talk about Omicron because there are several ways of looking at this. Some people in the health field believe that Omicron, which is obviously more contagious, but maybe less lethal, might actually mark the end of the health crisis concerning COVID. That's the potential good news, and we're going to talk about some of this, but the other problem is getting through this period where we've got a huge spike in cases. Look at the graphic here. This shows you in red where Omicron was going back to December of 2021, back on December 11th. And look at that number, January 10th. You can see it's just grown exponentially. And this is the problem. The healthcare system, of course, worried that they're going to get overwhelmed in the meantime. We'll look at hospital beds for a minute, and I'll go over this with Dr. LaBaer, who's going to be my guest. I'll bring him in a moment. Hospital beds, that up in blue is availability, headroom. You know, that really hasn't changed all that much over the many months. That's an interesting thing, but they're getting pushed. I mean, when you get down to 5% of headroom, that's a problem. Dr. Josh LaBaer is the executive director of the Biodesign Institute at Arizona State University, kind enough to join us on Newsmaker Saturday. Dr. LaBaer, thank you.
Oh, thank you. Thanks for inviting me.
Okay, where are we on Omicron right now?
Well, we are in an exponential growth phase here in Arizona. We're seeing day over day increases in the number of cases. And those are the ones we know about. The testing shows rapid increases, but our tests are only those people who are testing in facilities that get reported to the state. Lots of people don't get tested. Some people get tested using at-home kits, and none of that gets counted. So lots of cases in Arizona. Dr.
LaBaer, if, as it was explained to me, Omicron in this new variant, it makes perfect sense for a virus that it doesn't want to kill its host. So you end up usually with a watered down, hopefully a watered down version of the original, which isn't as lethal, isn't as problematic. And it strikes me that this might provide the herd immunity we've been talking about and that the vaccines have not delivered.
That's hard to say. This virus evades the immune system in terms of infection. Even people who've had previous infections have almost no immunity to getting infected by this virus. We've seen that over and over again. People who've been both infected and vaccinated have a little bit of immunity against getting infected by this virus. So that helps a little bit. What we do know is that vaccination prevents severe illness. And that seems to be true for Omicron as it is for all the other variants we've looked at. And so the most important message, if there is one, is vaccination prevents death. It prevents severe illness by a large margin. And so that we need to do. But we are headed towards what you're implying, endemicity, the virus being present with us probably forever, hopefully not always in a way that kills people.
Right. There are, I think now, some 400 studies, if I'm not mistaken, that say that this natural immunity is a really powerful thing. I hear you saying no. What is right? I am so confused on this issue.
Well, it turns out it depends on the variant. Previous variants like Delta, there was protection against infection if you were previously infected. But the data that I have seen, and both in terms of clinical cases as well as sort of the antibody levels, suggest that prior infection does not necessarily protect against infection, or not really very much protection against Omicron. Omicron has a number of mutations that allow it to slip away from the antibodies that people have produced to previous infections. So that's the concern we have.
Obviously, the Supreme Court spoke to the issue of mandatory vaccines for businesses 100 or more on Friday, saying that the administration, that it was overreach. You can't mandate putting a medicine in someone's body. Do you think that was wise, that decision? Is that wise public policy? Where do you fall?
I'm not a good person to talk about public policy. I will say that historically, we have mandated vaccines in places where the spread of an illness could impact other people and cause death. And so that's always been the motivation for trying to get vaccines in people. And certainly well, I can't really speak to the legal part, but what I can speak to is the public health part. If we can prevent the spread of this virus, it will prevent people from getting severely ill, prevent people from dying. And of course, it will prevent more mutations that could lead to viruses that will evade further treatments.
Okay, let's talk about what I kind of opened the program with. The glass half full researchers say Omicron may be the best thing that ever happened because it's not going to kill you. The lethality of it so far has not been great. And it may provide protection and provide immunity, herd immunity, or immunity to people who are resistant to going and getting a vaccination. That they're going to get it anyway, in other words. What do you make of that? Is that possible?
Well, it's certainly possible. However, it's getting ahead of what we know. We don't really know yet if Omicron does induce that level of immunity. And we do know that Omicron is still lethal. Certainly, it's important to remember that it's still very lethal to people who are unvaccinated. So people who are unvaccinated can still die very readily from this virus. People who are vaccinated seem to be protected, and it does seem that it is the virus is less lethal, but it's not lethal. It is still lethal. It's just less lethal than the Delta variant was. So we don't want to get too far ahead of ourselves, and we have to remember that viruses don't think. They don't try to mutate to become less lethal. It's just that over time, some viruses, and not all viruses,
right,
and not all organisms, become less lethal. There are some organisms that even over millennia remain still pretty bad for us.
Talk about the hospitals for a minute, because we've got kind of a convergence of things going on. We've got staffing problems. A guy I know who works in a major hospital, he said, look, you can't count a hospital bed if there's no one to man it, if you don't have people. So looking at hospital beds can be a little misleading. He said, we've got plenty of beds. We don't have staff to handle the beds we have.
Right.
Is that true?
We have big problems. Yeah, we're having a huge staffing problem. First, just in terms of having them hired. Secondly, in terms of now the hospital staff are getting infected by the virus, and so they can't go to work. Plus, we have a huge morale challenge. These people have been working in what is effectively a warlike situation for 2 years now, and they are exhausted. They're under a great deal of pressure taking care of all these patients, many of whom are very ill. And so that's a major problem. And on the other side, it's not just the staff that are exhausted, it's the patients. We have lots and lots of people in the healthcare system who had to put off cancer surgeries, who had to put off heart surgeries, waiting for, opportunities for the hospitals to open up. And they're still being delayed. They're still behind on whatever, elective cases they needed because of this pandemic. So there's a huge stress on the medical system, and it's one that concerns me a great deal.
Dr. LaBaer, do you buy this idea that we are going to have a sharp run up and a sharp peak, and then the cases are going to fall off the cliff as they did in South Africa, as they are doing in England right now? Do you believe that's the trajectory we're going to see?
Well, on one side, we think, well, if it heats up this fast, there's a good likelihood that it'll kind of, if you will, burn up its own oxygen. And there is some evidence in the UK that the number of new cases is beginning to come down. But if you look at the hospitalizations in the UK, they are still going up. And we have not yet seen where the deaths will lead at this point. So I think it's a little early to start running up a victory flag. It is possible that the case numbers will start to decrease. What really worries me is what's going to happen in the hospitals and as you pointed out, manning the hospitals and manning those beds.
I've got to ask you this as a final thing. This is an area that's really troubled me throughout this entire thing. That people who had different opinions, and I'm talking about smart people, and I think you know Dr. Robert Malone, who was one of the inventors of the mRNA vaccine. He has put out some contrary information to what is kind of the pro-vax side. And it seems that we are in a state in this country where we're silencing dissenting voices. And I'm not sure if it's good for science. I don't know if it's good for America. It seems like we're stifling debate here. What is your take on this?
I'm a scientist, and debate is how we live in science. I mean, in science, scientists argue with each other constantly, and it's what makes science strong. So we need to have different opinions, and we need to get them out in the air. That said, we need to back up our opinions with data. We need to be able to show the data, show the evidence, show the study, and argue, based on the evidence that we have in front of us. And as long as the debate is an open debate based on evidence, I think it's what we need to do.
But this idea of shutting people down and canceling them on social media or Twitter, you don't like that. That rubs you the wrong way?
Well, I have to say, I don't think social media is the place to have the debate.
Interesting.
Because the problem with social media is that you really don't have the evidence there. I think we want to get the evidence out into the scientific literature. That's where we should be having the debate.
That is a great point. It can become a cesspool, no doubt about it.
Yeah.
Dr. LaBaer, thank you for your time today. I'm hopeful. I'm always a glass half full guy. I'm hoping we're going to come out the other end of this, and at some point, we're going to see the light.
Oh, we will come out the other end of this eventually. I hope with a minimal loss of life and the minimal morbidity, that's what we all hope for.
Yeah, Dr. Josh LaBaer, thank you. Biodesign Institute. When we come back on Newsmaker Saturday, we're going to talk about the governor throwing down this idea during the State of the State about pulling water out of the Pacific, desalinating it, taking the salt out of it, and using it here in Arizona to water a thirsty desert. We're back with an expert on the subject right after this. Back on Newsmaker Saturday, this was a very interesting part of the State of the State earlier this week when Governor Ducey laid down the gauntlet for trying to look at options of converting salt water from the Pacific into usable water for us here in Arizona. I mean, 75% of the earth is covered with water, so a lot of people have wondered for a long time, and with the mighty Pacific right next door, why can't we just turn salt water into fresh water and be done with this water crisis? I mean, it's a plentiful supply, we know that, but it is wickedly expensive. Here's the governor talking about it this week in the State of the State.
One area where our work clearly isn't done is on water. Now, with resources available in our budget, a relationship with Mexico that we've built and strengthened over the last 7 years, and the need clear, what better place to invest more? Instead of just talking about desalination, the technology that made Israel the world's water superpower, how about we pave the way to make it actually happen? And we propose that we make a historic investment, $1 billion. Our goal, secure Arizona's water future for the next 100 years.
That was Governor Ducey earlier this week, and joining us now on Newsmaker Saturday, an expert in this field, Sarah Porter, director of the Kyl Center for Water Policy. Great to see you. Thanks, Sarah, for joining us.
Nice to be here with you.
The governor mentioned Israel, but there's Qatar, there is Australia. We're even doing this on the West Coast. I think we've got some 11 plants or so. You know this technology. Tell me the pros, first of all.
Okay, a big pro of desalinated ocean water is that it's a drought-proof supply. The ocean, as you mentioned, is a vast supply of water, and if you have an ocean desalination plant, you can continue to create very, very clean drinking water without worrying about a bad year, bad hydrology. That's the biggest pro.
What are the cons?
There are a number of, I would say, challenges. So for one thing, it's much more expensive than any water that is currently being delivered in Arizona. So it's expensive, it takes a lot of energy. So that's one thing, cost. There is a big environmental impact because the byproduct of desalinating ocean water is this salty brine. And you can't just dump that brine anywhere you want. It has to be carefully returned. Typically, it's carefully returned to the ocean so it doesn't kill all the ocean life around it. When we're talking about ocean desalination to serve Arizona water users, there are additional considerations that we might get into in our conversation.
Okay, let's start with the cost. There's a huge energy cost, right? You have two ways of doing this, as I understand it. You can boil the seawater and capture what is the water out of it, the steam. That's one way. The other way is basically good old reverse osmosis, right?
That's right. And the recommendation, so by way of background, as Governor Ducey mentioned, I mean, the state of Arizona has been working on its relationship with Mexico for some time, and that includes a binational scoping effort to see if a desalination plant would work, in which there was a plant in Mexico that served users in Arizona some way, somehow. And they, really smart engineers have investigated and concluded that RO is the preferred option for this concept for a binational desalination plant.
Okay, it is being done in San Diego area, I know, pretty big scale in Carlsbad. What have they found? And I'm sure you've looked at this because this is your field of expertise.
So the conclusion in terms of Arizona's benefiting from an investment in a desalination plant is that Arizona would help pay for a plant and take an exchange of some of Mexico's water from the Colorado River. Mexico is entitled to 1.5 million acre feet of water from the Colorado River. And so the idea is that the binational plant would be built somewhere in the Rocky Point area. The water would be delivered to lower the kind of southern California, where there is a sufficient customer base to use water that expensive, to use purified water that's essentially as pure as drinking water. And then Arizona, for its investment, would have the opportunity to take a portion of the Colorado River water that would otherwise be delivered to Mexico.
That isn't robbing Peter to pay Paul. In other words, Colorado River water, we want that. That's a great source and it's relatively cheap. Why would we want to trade Colorado River water for a plant that's creating water at roughly twice the cost of what we get out of CAP?
Great question. The reason is that we are looking at declining Colorado River supplies, and we're involved in a years-long discussion of how do we adjust to a long-term decline in Colorado River supplies for various reasons. And so this is one potential solution to help address that issue. And that brings up another really important question. We need to look at not only water for new uses, for population growth, for new economic activities. We also have to think about water to replace supplies that may be cut because of declining supplies in the Colorado River. So that raises the question, who would benefit from this, from a binational desalination plant? Would it be current water users, or would it be water users out into the future?
So this water, when it's done, if you desalinate the water through whatever process, it becomes a really nice quality of water. And maybe what strikes me is that the user that you want to identify that would want this and willing to pay for it might be chip makers or industry that needs a really good, clean product. Is that a possibility?
I think it is. It would be, because what chip makers do is they take our drinking water, which is already really clean, and then they ultra purify it.
Right.
And they, so they have all this byproduct of the water that didn't get through the filters for ultra purifying. So it could be, I've never studied this, but it could be that RO ocean water would be somewhere down the line, to the point of ultra purified.
Okay, I've got go ahead.
You're on the right track, which is to think that the people who would use this water are going to be residential customers, municipal, commercial customers like restaurants or businesses, or some kind of industry that needs extremely purified water. And that's to say this water would not be water that you would use to grow cotton, for example.
Right. It's too good and it's too expensive. Okay.
It's just too expensive.
Macro view. With the Pacific Ocean just a few hundred miles away from us, Is it safe to say that we really should never face a water crisis? That there's always a way out with that resource to the west and south?
I would say there's always an engineering solution, and that's the easiest part of it, the engineering. We can always think of ways of moving water, and people are super creative. I mean, there's a proposal to drag icebergs to the West Coast and somehow move that water. The issue is not the engineering solution. It's really whether we would ever have the capacity to use water that is so expensive. When we think of the small amount of water we need to use inside our homes, when most of that water is captured and reclaimed, it can be treated back up to drinking water standards. And by the way, about 93% of the water that we use in central Arizona that goes down the drain or is flushed, is treated up to drinking water, can be reclaimed. It isn't all now reclaimed for direct potable reuse, but someday it may be. So the issue isn't, we'll never have a water crisis because we have California and Mexico and lots of water from the ocean. The issue is, could we afford this very expensive water?
Yeah.
In this particular proposal that has really been scoped out, the idea is that in this exchange where Arizona would take Colorado River water, the most we would get during down the way is 200,000 acre feet per year. So this year we are having a cut of over 500,000 acre feet of water, of Colorado River water delivered to Arizona. The state, working with California and Nevada, has agreed to find another 500,000 acre feet of water from the three states to conserve in Lake Mead. So 100,000 to 200,000 acre feet of water, while no one is saying no to that additional supply, it's not the big solution to Arizona's water problems.
Could it
ocean
be
desalination probably won't be the big solution.
You don't think so?
Not until very far into the future.
Yeah, I was thinking, technology advances, but as you were telling me before the program, the process of reverse osmosis is about the best we've got, and that isn't going to necessarily change. We may not see a dramatic leap of technology. I suppose it's possible.
And it's possible. We haven't seen it in a long time, but also it's extremely expensive and energy intensive to move water.
Right.
And so it's one thing to have water flowing down a river and have it land in the reservoir, but it costs a lot of money to move water, and especially when you think of having to pump it up from sea level up to higher elevations. So, energy isn't getting cheaper. It could in the future, but these are all considerations that go into why ocean desalination is not, at least right now, the immediate big solution for the state.
Yeah. Or we'd already be seeing it online in an even bigger scale, but some countries are living with it. So it's being used, and it's encouraging that we're looking forward, which fortunately our water forefathers in this state, John Kyl, one of them, have really tackled this and looked at it hard. And as I've understood, we've actually been looking at desalination for about 20 years here in Arizona. So
that's right, and it'll take another 10 to 20 years to actually build a plant and benefit from that.
Hey, thank you so much, Sarah. Sarah Porter, Director, Kyl Center for Water Policy. Great information, and it's great that people are looking at it. It's a great option. Thank you, Sarah. We're back in a minute on Newsmaker Saturday. Welcome back on Newsmaker Saturday. Just a thanks to all of you for watching the program. It has done extremely well in this time slot, and we get into discussions that you just don't get on the news. So I appreciate you watching, I really do. If you want to see a prior show, this may be the easiest way to do it. Fire up your camera on your smartphone, take a picture of the QR code, just line it up, and it'll take you right to the website, fox10phoenix.com/newsmaker. You can see a prior episode of Newsmaker Saturday. That's it for us this weekend. We'll see you next week on Newsmaker Saturday.